My name is Dr. Ali. Welcome back. For those of you who are joining us for the first time, please make sure that you subscribe to be part of this healing community where we share knowledge and research that we need to heal and sustain good health. I'm a functional physician, and my goal is to provide education and guidance to our patients, their families, as well as our community on how to achieve optimal health and wellness. Everyone has the ability to achieve optimal health by making simple, sustainable changes to our lifestyle. We can prevent and even reverse chronic disease. So let us talk about what is it that we want to talk about today. We're discussing an important topic, and the topic is a functional approach to treating migraine. So let us start by talking about what is migraine. So basically, migraine is a complex neurological disease. In this disease, the person experiences several different phases. The first phase is the trigger phase. So, migraines are often triggered by various factors such as hormones, certain foods, dehydration, stress, sleep disturbances, and even sensory stimuli such as bright lights, loud noises, weather changes, and medications are all potential triggers that can lead to the next phase, which is the prodrome phase of the migraine. So, this phase occurs hours to days before the onset of a migraine attack. And some individuals may experience subtle changes, including mood swings, irritability. Um, they may have some food cravings. The next phase is aura. Not everybody is going to have aura, but about 25% of people with migraines do experience an aura, which is a neurological symptom that usually occurs before or during the headache. In most cases, it's a visual disturbance like flashes of light or blind spots, zigzag changes, or motor disturbances. The duration of an aura is typically less than an hour, and then this is followed by the fourth stage, which is the stage of the headache, which is the most recognizable and the most debilitating phase of migraine. It involves pulsating or throbbing headache, usually on one side of the head, and the pain is accompanied by nausea, vomiting, sensitivity to light, and sensitivity to sound. And this phase can last anywhere from a few hours to several days. There is another stage, which is the fifth stage of migraine, which we call the post-drome stage. Following the resolution of the headache phase, some individuals may experience this phase called post-drome or migraine hangover because people may often feel very exhausted, confused, moody. They may even have difficulty concentrating, and this phase can last for several hours to days. So, as we see here, that even though migraine is often considered as merely a headache, there are actually multiple phases to having a migraine. And it is very important to understand these phases because each of them are telling us about what is happening inside the different neurons or nerve cells in the brains, which is affecting the function of these cells and ultimately affecting the function of the brain in these individuals, leading to these different phases. Now, there are many different types of migraines. The most common type is the migraine without aura, which accounts for 70 to 90% of all cases. The second type is the one with aura, which is about 25%. And as we talked about before, that these individuals may have an aura which typically precedes the headache. The third type of migraine is the hemiplegic migraine, and this is characterized by temporary paralysis or weakness on one side of the body, and this can last from several minutes to hours or even days. Another type of migraine, which is very debilitating, is the chronic migraine. Chronic migraines are diagnosed when a person experiences migraines on 15 or more days of the month for at least 3 months, and at least 8 of those days are accompanied by migrainous headaches. Last but not least, there is a migraine that we call menstrual migraine, and this is experienced by women, and this is linked to the periods or the menstrual cycle. These migraines typically occur in the days leading up to, during, or after the menstruation. And these headaches or these menstrual migraines are directly indicating the presence of hormonal imbalance. So, what are the risk factors for migraines? So, one of the most important risk factors is that there could be an underlying family history, which means that there is a genetic predisposition to migraines. So, if one or both of your parents have had migraines, you are at risk of having migraines too. The second important risk factor is that women are more likely to suffer from migraines than men, particularly the hormonal migraines that occur around periods. As far as age is concerned, migraines can occur at any age, but they often start during adolescence or early adulthood. And the frequency and severity changes over time, and some people may experience fewer migraines as they age. Hormonal changes, as we have talked about, can definitely predispose a woman to migraines, and in these cases, the estrogen levels is often what triggers the migraines. Migraines are also seen in women who are pregnant and also after development of menopause. Certain medical conditions are associated with increased risk of migraines. For example, individuals with epilepsy, depression, anxiety, stroke, or other neurological disorders have a higher likelihood of experiencing migraines. A very important risk factor for migraines is lifestyle. So we know that individuals with irregular sleep patterns, poor sleep quality, excessive stress, dehydration, individuals that skip meals or consume certain foods or drinks, such as alcohol, caffeine, or they get exposed to certain food preservatives, are highly likely or have a higher risk of developing migraines. And some of these actually are the triggers for migraines in these individuals. Migraines are very common, and we know that according to the Migraine Research Foundation, we have about 39 million people between the ages of 18 and 44 that actually suffer from migraine. And we also know that women are 2 to 3 times more likely to develop migraines. We also know that the impact of migraines goes beyond the individual experience of pain and discomfort, because these migraines can significantly impact the quality of life of the person, leading to missed work, missed school days, reduced productivity, and limitations in daily activities. So, what we now know is that there are certain early states of migraine. So we know that mood changes, particularly mood fluctuations and or mood swings, are seen during the phase before the headache. So the individual may feel irritable or anxious or depressed, or they may even have sudden shifts in emotions. The other thing that is often noted is that fatigue and yawning is also experienced before the headache in certain individuals. Food cravings or changes in appetite are seen in people at times before the development of the headache. Um, Neck stiffness, tension, or pain in the neck muscles is also commonly seen in certain individuals before the headache. Increased thirst and urination are also observed in some people before the development of the headache. So let's talk about the triggers for migraine because these are extremely important and they give us a clue as to why the brain is actually malfunctioning. We now know that migraine is a result of inflammation of the brain cells. And so the question is what is causing that um, inflammation leading to the malfunctioning of the brain? Um, so basically, we know that during migraines, there is abnormal brain activity and there is changes in the function of the nervous system. And we now know that it is the release of inflammatory substances uh, inside the body, and particularly in the brain, that leads to changes in the blood flow. And there are also changes in the neurotransmitters, which are the messengers in the brain, such as serotonin, which leads to the initiation and progression of migraines. And this is a very important fact because if we can identify the source of inflammation, then we can reverse the problem of the migraine. The second important trigger that is now known is environmental factors that can actually become the source of the inflammation that we talked about earlier. So we know that environmental toxins can trigger migraine. So, if somebody is being exposed to certain chemicals all the time, and those are the source of inflammation, then that could be one of the possible sources of migraine in an individual. We also know that hormonal changes, uh, particularly hormonal dysfunction, such as fluctuations in estrogen levels or what we call estrogen dominant states, are important triggers for migraine. Similarly, if there are any food sensitivities in an individual, for example, sensitivity to chocolate or caffeine or processed food, then that becomes a source of inflammation. We also know that some of these individuals actually have sensory sensitivities, and so their nervous system is already pretty active. And so when these individuals are exposed to bright light or loud noises, or even something like change in the weather, then these individuals are going to have migraine because this is basically causing an aggravation of the inflammation that's already present. We also know that during migraine headaches, there is a change in blood flow, particularly dilation of the blood vessels. And constriction of the blood vessels. And so some blood vessels can dilate and others can constrict. And so the changes in the blood flow are an indication that there is a possibility of some kind of a vascular inflammation, which is leading to abnormal functioning of the blood flow. So let's talk about complications of migraines. So these individuals who have migraines not only are suffering from headache, but they actually have complications associated with migraine, one of them being depression and anxiety. So these individuals who have chronic pain or chronic migraines are at increased risk of developing depression and anxiety. And there is obviously the fear of an impending attack. The second really important thing to understand is that studies have found that individuals with migraines are at increased risk of developing cardiovascular diseases such as heart attacks and strokes. And the connection is thought to be the inflammation, which can affect the heart and cause heart attacks, and it can affect the brain and it can cause stroke. And as we have talked about before, the inflammation in the blood vessels of the brain can cause migraines, and the same inflammation in the blood vessels of the brain can also cause stroke. And if the inflammation is in the blood vessels of the heart, then it's going to cause a heart attack. We also know that migraines can lead to cognitive difficulties, such as problems with attention, memory, and language. And these issues may become even more pronounced during a migraine attack, but they can actually persist between attacks. Again, indicating that there is a consistent baseline of inflammation, which when it flares up leads to migraine. And then, last but not least, we know that migraines can cause significant fatigue, not only during the attacks, but also between the attacks. And this is what leads to reduced productivity as well as social withdrawal and a significant reduction in the quality of life of these individuals that suffer from migraine. So, how do we test these individuals from the functional standpoint? So, the goal of functional medicine is to address the root cause. As we have talked about before, one of the most important things to understand is the role of inflammation in the neurological dysfunction, which means that the inflammation is the root cause of the neurons not functioning optimally. We also know that the inflammation does not have to be in the brain. The inflammation could be in another part of the body, and then that inflammation can be carried over to the brain. We also know that there is a very strong gut brain connection. So, when we are looking at um, a person who has migraine, and from the functional standpoint, we want to know the root cause, then we will look at all the variables such as inflammation, such as hormonal dysfunction, in order to assess for the root cause. We will also look at food sensitivities. We will also look at the possibility of environmental exposures, which may be causing the migraine, and address those. So, the functional approach for testing in migraines will be dependent on the history of the individual, which will help us figure out what could be some of the variables that that particular person may have that are now the root cause of their migraine. And depending on that, we will decide how are we going to test this individual, what variables are we going to look at. So, what are some of the strategies for treating migraine in functional medicine? So, one of the very important strategies, as we have talked about before, is to identify and avoid the triggers, because until and unless we remove the source of inflammation, we are now going to be able to reverse the problem. And so we want to kind of find out what is it that is leading to the migraine, whether it be hormonal dysfunction, or whether it be inflammation, or whether it be an environmental toxin, so on and so forth. Another very important area is to understand that there is a very strong connection between the gut and the brain. And so these individuals who are actually having migraines may be consuming certain foods that may be leading to inflammation, or these individuals may have leaky gut. And so it is very important to identify potential dietary triggers and develop a personalized nutrition plan for these individuals so that they are not constantly creating inflammation. It also means that we have to work on the gut of these individuals, because we know that the gut, particularly the gut bacteria, presence of gut fungus, or other sources of inflammation inside the gut, could be the source of the inflammation that is causing a dysfunction of the nervous system. We also said that inflammation might be a very important factor in migraines, which means that these individuals need to be on anti-inflammatory diet in order to be able to reduce the degree of inflammation that they have. Another important area is to know that we now know that individuals with migraines often have nutritional deficiencies, and some of the nutrients which we know are particularly low in these individuals include migraine. We know that magnesium deficiency may contribute to the development of migraines by affecting the blood flow as well as the neurotransmitters or chemical messengers in the brain. A second important nutrient in the context of migraine is riboflavin, which is a B2 vitamin. It's involved in energy production, antioxidant activity. And some studies have suggested that riboflavin supplementation can help reduce the frequency and duration of migraines, possibly by improving the function of the mitochondria. Mitochondria are the small, tiny structures in the cells responsible for providing energy. And dysfunction of mitochondria would mean no energy for the cells, which means really suboptimal functioning. We also know that riboflavin or B2 vitamin also reduces oxidative stress. Oxidative stress is actually a phenomena which is the result of inflammation. When there's a lot of inflammation, there's production of free radicals. And these free radicals are charged molecules, and they are extremely harmful because they actually destroy the healthy tissue. And when that happens, then we say that there is oxidative stress. And we know that B2 reduces oxidative stress, which is possibly one of the reasons why it has worked in some people who have had migraines. Another very important nutrient implicated in migraine is CoQ10. CoQ10 is also a nutrient which is involved in energy production and reducing the oxidative stress because it has antioxidant properties. So, some studies have found that CoQ10 supplementation can also be effective in reducing the frequency and severity of migraines. Having said that, it is important to know that simply addressing nutritional deficiency does not necessarily address the root cause. And so it is perfectly fine if nutritional supplementation helps a patient with migraine, but the real issue is to know why is that deficiency happening. And then understand the root cause of why certain things are happening so that we can address those. Stress management. We know that stress is a very important trigger, and hence, stress reduction techniques such as mindfulness meditation or mindfulness coaching is extremely helpful to promote relaxation, reduce stress levels, and potentially lower the frequency and intensity of migraines. Sleep hygiene. So we know that poor sleep, irregular sleep patterns contribute to migraines. And so working with these individuals with migraines, it is important that they have consistent, good quality of sleep. It also would mean that they will have to have a routine whereby they are avoiding exposure to blue light very late at night. Hormonal balance. This is particularly important for women who are experiencing menstrual migraines. In that case, it's important to understand why is there estrogen dominance and be able to address the root causes of estrogen dominance. We know that mold toxins, also called mycotoxins, are produced by certain types of mold. And we know that exposure to mold toxins can lead to a number of health issues, including migraine. Some patients are more susceptible to the effects of mold toxins than others, and these toxins can trigger migraines in certain individuals. Uh, the other possibility, in addition to mold toxins, is environmental toxins, which can also cause migraines. Certain medications have also been linked to migraines. For example, certain antibiotics and blood pressure medications have been known to trigger migraines. Last but not least, electromagnetic radiation is a very important toxin to take into consideration these days because we are being exposed to it more and more. So, electromagnetic radiation is a type of energy that is emitted by electronic devices such as cell phones, computers, and Wi Fi routers. And so it is very important that we understand that studies have shown that EMR or electromagnetic radiation from electronic devices may affect the nervous system. It may disrupt the balance of certain chemicals in the brain, leading to migraines in susceptible individuals. So it is very important to understand that the toxins play a very important role, which means that detoxing these individuals is very important, and also removing them from the source of the toxin is very important as well. So thank you so much for being with us, and we hope that you can join us another time for more information and knowledge about how you can improve your health.